Joining me in the studio is Pascal Achunine, CEO, Health Emergency Initiative. Good morning.
Good morning. Thanks for having me.
All right. While Julie Mogbo, Executive Director, Royal Nursing Consult, joins me via Skype from Abuja. Julie, good morning. Thank you for joining us.
Good morning.
Now, let me begin with you, Julie. Talk to us. This new no death case reported in 12 days, so to speak. What do you think could have been responsible for we not recording any deaths?
Thank you very much. Well, I would say that I think that there has been lots of lessons learned, especially maybe from other countries who are able to contain this pandemic. I would want to believe that the stakeholders aren't sleeping. The presidential task force are not sleeping. So there are continuous discussions, deliberations, and revisiting of strategies as to how we can put a final stop or control over the pandemic. For us to not have recorded deaths for this number of days is quite commendable. So I think that there are some people who have decided to sit down and get to work. So either strategies are being revisited, either reallocation of funds, appropriation of resources, and all of that. Some work must have been going on to enable us record this number of days without any fatality.
All right, let's bring the conversation to the studio now. Pascal, I wonder if you shared the same view with Julie Mogbo, talking about perhaps there has been some level of re-strategizing and lessons have been learned from other countries. Because, you know, before now, the issue was the fact that a lot of Nigerians were not willing to take responsibility for their health. So what do you think we could have learned? What do you think changed, basically?
I want to start by wishing our dear comrade Nira Atiba a happy birthday. And it coincides with a time of prolonged period of no death. So
absolutely,
we are excited about it. I actually think I align with us, and also want to add that, of course, if you look at the figures, we are having we had 37 yesterday, based on the report from NCDC. And as against what we had about 2 months ago, 2,000, at the time it was close to averaging 1,000 per week, sometime in February and March. So it is also, besides the commendable steps taken by the government and the stakeholders managing this, it is also obvious that if you have fewer numbers, you have more oxygen, you have more personnel that can pay more attention to those cases. If you juxtapose it with what we have currently in India, where the number is 300,000 per day, 2,000 deaths.
A critical situation.
It's critical because they are running out of oxygen, even though India has a lot of resilience in managing cases, health-related cases, but they are virtually overwhelmed.
But I also talked that perhaps the variant is also a viral one that is really dangerous, perhaps.
Yes, that's also why we will not drop the ball, because we have recorded this 12th day of 0 deaths. So we must be vigilant, because we have seen mutation happening in different jurisdictions. Besides India, at a time, Australia, South Korea, it was as if they had successfully resolved it, and after a while another variant came. So yes, the variant in Nigeria may not be as devastating as what we are seeing in India and other parts of the West, but the exciting, rather than only being excited, we must take immediate steps to watch and maintain the non-pharmaceutical interventions that we have put in place before now. And whatever model, it's also good to look at it again. Whatever step NCDC and other stakeholders have taken that has resulted to this progress or mileage recorded, they must maintain it and perhaps improve on it.
But some, Julie, would say that perhaps because we have started vaccinating, perhaps that could have played another role. According to the data given by the NCDC, Nigeria has vaccinated over 1 million people out of the over 3 million doses of vaccines, 3.9 million doses of vaccines that we received in March. Do you think that that could also have played a role?
Well, I don't know if you can hear me. Yes, I would say that that also has contributed in the fight against the global pandemic, like what we are currently facing. A lot has to be brought to the table. So the vaccination definitely would have made some positive contribution in ensuring that we record no fatalities. And I also think that the awareness campaign at different levels have also been well accepted by a number of people. There were those who were doubtful at first, especially as we had conspiracy theories all over the place as regards the potency of the vaccines. But that has greatly improved. There are people now that are more open to receiving it. So it's not out of place to say that this has contributed to what we are currently experiencing.
Right. So, Pascal, out of this 3.9 million doses that we received, just over 1 million has received it between March and now we are at the end of April. How do you think we can perhaps leverage on that to ensure that we drive this push for vaccination? Because we still see that there's still vaccine hesitancy. And recently, the Vice President was talking about vaccine nationalism.
It's cheering to note that this morning, there's an update from National Primary Healthcare Development Agency that Nigeria has concluded arrangement for 29.8 million Johnson & Johnson vaccine to get here either late May or early June. So I think it is a very cheering news because it would help in creating the required herd immunity over time. Because by the time we achieve that, it would first, when we had this issue in India with the rate of infection and the last vaccine came from India, so people were having concern as to when Nigeria can access vaccine again. But COVAX and other stakeholders that have tried to drive vaccine equity, ensuring that jurisdictions that don't have capacity, especially low income and middle income countries, can also have access to vaccine. So that is, if based on that feedback, that is seemingly working. It means that if we get our traditional almost 30 million vaccines, that will be taking the coverage to a wider scale. Perhaps it will be getting to 15% of the population or so that will have access to vaccine between the next 180 days.
So how do we begin to change this issue of vaccine hesitancy? Because we still have that deeply rooted in Africa and Nigeria as a whole.
I think with what Julie said, more awareness, enlightenment, bringing persons that have taken the AstraZeneca, even with some supposed cases or some unfounded cases of blood clot. Okay, there were a few cases, but I mean, people have taken it and there has been no side effect.
Right.
And for Johnson & Johnson, it seems to also have some competitive advantage that people will be willing to take it. I think it's about awareness, it's about advocacy, it's about calling those who have taken the vaccine to present themselves to say, oh, this to disabuse the minds of Nigerians that there is no death sentence, there is no mark on the devil or the vaccine. It's just normal vaccine like polio. So we need to just demystify that it's the same as if your child is going for polio vaccine.
Right. Julie, one issue that has also been of concern to a lot of persons is how well we are working with data at a time like this. This report that has to do with we not having a fatality or not recording a fatality in the past 12 days, some persons still do not believe it because they think that we are not doing enough in terms of testing and all of that, surveillance, and the like. So from your observation, how well are we working with data to address these issues?
Well, I'll be speaking from the observations that I have made personally. First of all, we cannot but take the reactions of these people, these concerned people, as a form of feedback. So if there are a group of people who think that we are working poorly and do not have enough data to support whatever claims we put out there, maybe on the media or in any form. It's for the authorities to look into these and see how best they can communicate to people. If we actually are working with data, now is the time to bridge the gap and give quality information to the people. Once that there is a gap in communication, you give people room to assume anything. So from my observation, I feel there's still a whole lot of work to be done. As regards data generation, documentation is key. So when you're attending to people, if we go to any facility now, can we have information about how many people stepped in? Well, I will say largely, because I have taken a trip to different places, and I see that there is a greater percentage of adherence to the protocols that have been set in place by the authorities. So we need to know the number of people that are gathered in a particular place at a certain time, and they are adhering to the preventive measures, which is the wearing of masks, physical distancing, and all that. That is being done on the part of the people. But when it comes to the authorities, the hospitals, the government, and all that, I think the best way to allay one's fear, anxiety, or concern is for them to do better with communication. I have always emphasized the importance of it. Once there is no effective communication, we give room for people to assume things, and they act based on what they think is going on and not the reality. I think there's still a lot of work to be done as regards generating data, because data would empower us to work. So the strategies, the resources will be appropriately channeled when we have data to work with. So the question for authorities would be that, what data do we have? How are we generating this information? What are we using? What are we doing with the data that we have? So it's a feedback. If we hear this from the people, let's go back to the drawing board and identify the gaps and devise measures in order to bridge it.
Right. Now, let's bring it to the studio, Pascal. This issue of data is a huge concern, because if you look at the level of testing we have done in comparison with other countries, it's abysmally low. And that is where the issue of not trusting the figures have come up. This is not even the first time a lot of persons are saying we can't really trust the figures coming out of this place, because how much are we doing in terms of surveillance? How many testings have we carried out so far? I mean, it's already a year since we recorded the index case, and what we are saying is that we have just carried out over 1 million tests in a country where you have 200 million people. So how do we begin to ensure that we inject data and perhaps spread our tentacles to, we have data everywhere and we need to use it?
I have actually advocated several times that there should be a collaborative measure or approach to dealing with the issue of data, because you can't just plan and get good results in a country where virtually everything is based on estimate, is assumption. There is not views based on empirical information, empirical data. I want again emphasize that the private sector, together with relevant, this is not NBS, Nigeria Bureau of Statistics, is a broad-based initiative that must be intentionally and strategically adopted by stakeholders. Okay, this is what we want to do, and these are the protocols. These are the best standard operating procedures for data storage, data processing, management, and sharing. And I put it on the doorstep of the government, but I also urge the private sector to come together because interestingly, if you go to the private sector, most of them have a way they get around data for whenever they want to achieve something.
Absolutely.
So we can say, okay, what has worked in the private sector? Can we even replicate it for the general good of this society? So whether it's coming from research, working with research-driven entities, or like in the medical space, Nigeria Institute of Medical Research and other research institutes, that could
have them.
And we have them, and some of them actually, in the interaction we've had recently, some are thinking a lot outside the box to integrate a PPP approach to make sure that we deal with the issue of data. Otherwise, we will keep sitting, and you can't achieve major development without data. And talking about the tests you mentioned, at this stage, I think we need to accelerate the deployment of rapid tests. They use it in the orientation camps for NYSC participants, and it worked. So the PCR is very expensive. The PCR cannot be adopted everywhere. You can even target at the primary health care centers. Each of them should be a platform where this rapid test can be conducted, so that we'll see more persons tested, and it can validate that, yes, truly, when we say that we have fewer people, it is a reflection of...
I mean, if we can deploy vaccination to that level, why can't we do that for testing?
Absolutely. So, and the rapid tests are here, because from what the feedback in the interaction with NYSC officials, they indicated that there was over 95% certainty in the results they conducted with rapid tests. When they ran it with PCR, they were virtually the same. So we need to do that to reinforce this. And I just want us to mention briefly, India has a lot of interaction, trade, and other, and of course there are many Indians resident in Nigeria. So it's also good that from a very proactive standpoint, we take steps to make sure that we don't have any wave coming from possible engagement, interaction, or travels across these jurisdictions. At least take extra steps to protect this current mileage of achieved.
Speaking of wave, what wave are we in now? Because we seem to not really know.
In some countries, they have done the third wave. Some, like Iran, is on the fourth wave. But most parts of Europe, they're on the third wave. Some have said that the third wave is even typically worse, because when they made a comparison with the Spanish influenza in the 1920s, that it was also as horrific when it happened. The third wave was very horrific. So we must also avoid a third wave, so to say. Yes.
All right, Julie, your final word with regards to how we can sustain this record that we have had in 12 days, no fatality.
Yes, so I would recommend that the stakeholders, the government, would revisit the goal. What is the vision, first of all, that we have? A leadership without a vision will not be able to achieve a sustainable means or outcome. So let us revisit the strategies. How proactive were we? What were the gaps? And what can we envisage that could be further risk that like we're talking about the third wave, others are experiencing it already. So what steps did we take? Where did we miss it? So we need to be proactive this time around in order not to open our doors to a third wave. There's a need to look at the strategies that we have used. There's a need to become more innovative with our awareness campaign. Let's reach out to people, especially with the vaccination. Let's get more people to embrace it, to open up their hearts to being vaccinated. Then we need to also strengthen our internal structure, the healthcare system. There's a need to look at it. It's important for the government to know that where there's distrust, there won't be any form of commitment, whether it's on the part of the professionals. Some of them, yes, because they are bounded by the oath they have taken to serve, so they are forced to work. But on the people, it's important for us to address that matter of distrust, so that we can get the commitment that we need from all quarters in order to fight this.
All right, we'll leave the conversation here now. Julie Mugbo, Executive Director, Royal Nursing Consult. Pascal Achunine, CEO, Health Emergency Initiative. Thank you for joining us on The Breakfast Show.
Thank you for having me.
Thank you very much.